Welcome to Health Systems CIO's interview with Mike Shrader, Director of Information Security with WellSpan Health. I'm Anthony Guerra, Founder and Editor-in-Chief. Mike, thanks for joining me.
Hey, thanks for having me, Anthony.
All right, great. Looking forward to having a fun chat. Mike, let me start out by asking you a little bit about your organization and your role.
Sure. Yeah. I'm as you said, I'm Mike Shrader. I'm the Director of Information Security for WellSpan Health. We are an integrated delivery network in South Central Pennsylvania, as well as the northern part of Maryland. We have 20,000 employees. We have of that 20,000, 2,000 are employee providers. We have 220 locations across South Central Pennsylvania and Maryland. We have 8 hospital systems, along with home care services, as well as behavioral health.
All right, very good, Mike. Do you report to a CISO or do you function as the CISO?
At this point, we do not have a CISO, but I would be the highest functioning leader with security as my focus.
hmm Is that an open position, or are they going to fill it, or are they going to create it, or are they just going to stick with you as the director?
At this point, we haven't decided if we're going to have a CISO,
hmm
or if one is necessary. But I do report to our Chief Technology Officer, who reports to our CIO. We all have a heavy focus and paranoia around security.
hmm
But at this point, no, we do not have a CISO.
All right, excellent. Tell me, I like to start with an open-ended question, see what's on people's minds.
Sure.
What are some of the things you're thinking about, looking at, trends you're watching? You could either talk about any projects you have. Some people don't really want to do that, but just what are you looking at? What are you thinking about?
There's things you you have to think about. Things that are always in the news, things that are constantly running through either my news feeds, my social media feeds. Everything's related to some sort of attack that is happening. A majority of those are ransomware. I'm sure that's the topic. It's probably top of mind for most healthcare organizations, and organizations in general. So we constantly, have to review and evaluate the different attack techniques, and compromise methods that are disclosed. Not everybody shares all the details, but we pay close attention to all of the details that are shared, whether it's publicly or through information sharing channels that we have. Um, so those are things that are always top of mind for me, to make sure that we're always staying ahead of that, because we patient safety is top of mind for not only everyone in our organization, but for me as a focus is how do I play into that, and how does my team help make sure that we can see and treat patients effectively.
All right, so there's actually a lot there, right? I mean, let's talk social feeds. Let me start with that because I get this
Sure.
I don't know if it's an anxiety, but it's like an endless fire hose that you can drink from. And it's like, well, how much time am I going to spend on LinkedIn reading posts and updates? I have to come up with some methodology so I'm not overwhelmed. Like either I look at it for 15 minutes and hopefully they've got an algorithm that's showing the most important, because especially in your business. I mean, and we'll talk more about this, but there has to be a methodology to your consumption of information, because if not, that can be all you do.
Yeah, I'm hoping the algorithms are helping me get the most important things, right? But yeah, it's after you watch the same folks, and you really have to curate who you follow. So make sure you trust who you follow in those different social feeds, is really important, and making sure that the information they share is credible. And then also, where I usually find the most value is finding folks that are saying the same thing, or sharing the same articles. So then, there's a little more legitimacy behind those. Again, you still have to read every article and take out of it what you can. So I don't know if there's a secret sauce to that, but that's what I found has been, I think has been effective for us, or I feel has been effective for us, at least from my perspective. I'm the one that sort of keeps track of all the social stuff for our groups, between all the different social media platforms, whether it's X, Twitter, whatever,
Hmm.
and LinkedIn, and then usually seeing is the same information being shared in both areas, because those seem to be the most credible when you kind of correlate them together.
So I've interviewed a lot of CISOs, and what you mentioned about knowing what's going on out there. What are the latest attacks? What are I guess you call them indicators of compromise, right? IOC. So
Yeah.
what's going on? That kind of relates to, cyber hygiene in terms of patching. Um, what are the latest attacks? What do I need to do? I spoke to one CISO who said this is one of the most important things that he's doing. It's um, speed to deal with these things. So you find out something's going on, you find out if you have a vulnerability there or not, and you address it as rapidly as humanly possible, because the bad guys are getting the same information and they may have had it before. This is the other thing I'm thinking this morning and reading some stuff about these 0 days. They're sitting on these. So the bad guys get the 0 day and they're sitting on it, right? They've got it. They're not ready. They're going to take their time. And maybe as soon as they see that this is made public about the vulnerability they've been holding on to, bam, they're going to launch, right? Because not everyone's going to patch instantaneously. Your thoughts about this speed to address? I forget the acronym. I have it here somewhere. Um, Basically, it's the time to address. But this speed component to your job about intelligence address, intelligence fix. Tell me about that.
Yeah, it's a dance for sure. And Anthony, are you referring to like 0 day vulnerabilities, 0 day attacks, things like that?
Right. Yeah.
So yeah, so it's our the time we have to address vulnerabilities has significantly decreased over the last few years. Um, and is it and it's one of those things is where we get a lot of information. So there's a lot of public information out there. Are the attackers also leveraging that same information, which makes them more likely to act quicker, because now that everyone knows about the attacks that are out there, they have to move fast if they want to take advantage of them, right? So we have to evaluate quickly too. So us having not only the information that's shared with us, so we have the knowledge in hand, but we also have to have the knowledge of our systems. So we have to know where is that where is that applicable in our environment? What is truly exposed? What can be taken advantage of quickly? Is it something that's internet facing versus, it's just, it's behind our firewall, so we have a little more time, but we still need to move as quickly as possible. So yeah, those time frames are really shrinking. But we have to be very transparent with our internal teams and partner with our internal teams. And I think that's something that we do really well in our organization here is it's a partnership. We understand the impacts of not addressing certain vulnerabilities and what could happen. But also the other side of this is not, it's not just, we can't just rely on one hole to breach our systems. We have to have different defense in depth mechanisms. So yes, we didn't patch this one system this one day. Somebody got in. There has to be other things that are there to either prevent or detect those attacks. So we need to patch as quickly as possible, but we also have to have those layers to help us, protect ourselves and our systems.
Yeah, really good points. So knowledge, let's touch on knowledge of our systems, right? You have to know what you have in order to know if when there's threat intelligence comes out that, hey, this is what's going on, or move it, or something like that comes out, and they say it gives to you, and you don't want to be like, well, I don't know, right? I mean, that log4j, a lot of people didn't know because I guess it's complex and it's inside stuff, which is why they want to talk about the S-bomb and all this stuff, a label on which when I've heard people talk about how difficult that might be to operationalize, that sounds a little tough, both to create on the manufacturing side and to absorb in any meaningful way. It sounds like it's not as simple as it might sound. But talk to me a little more about the knowledge of our systems. How does a security professional get that good knowledge of their systems as opposed to someone that really doesn't have a good grasp on what they have?
Yeah, I mean, it's critical. It's one of the foundational parts of any good cybersecurity framework that you work with, whether it's from NIST or CIS. Understanding your assets is critical. So for us, it's, you get that information a lot of different ways. Whether you do your own vulnerability scanning, so you scan all of your systems, you look for all the different vulnerabilities. That's going to help you know what's vulnerable. But then, you have to have some sort of asset tracking system, so that way you can tie that all back together. But you have to be able to understand what those assets are. And so really working with the different teams to understand at least where you need to go to get the information. Now, I don't need to know what every single system does,
Hmm.
what, all the servers that tie to each system, but we need to know, who owns those systems, and those system owners need to understand their infrastructure, so that if we say, for instance, like we talked about Log4j, that the fire drill that it was, understanding and telling the teams, hey, we found this vulnerability. It is very critical that you patch your system, and here's why. And then, but they need to understand, either they need to look into their systems, if they find they find that component themselves, or knowing where to get that information from if they need to reach out to their vendors.
So is that what you're talking about? Is that sort of a communication between you as security and the business owner, or is it you as security and IT who's going to sort of liaise with the business owner? I can't imagine many business owners are going to have much technical knowledge about the
Yeah.
applications they're running, and they're going to say, "Mike, I don't know."
No, yeah, you're absolutely right. So the way we've handled it in the past is we'll gather the entire IT team, because our IT teams will support the business. So they may not own the application themselves per se, so they may not understand how the business uses it completely, but they understand the functioning of that, and they'll have to work with their business owner to relay any impacts of having to patch or take their system down for maintenance or whatever is necessary at our request from a security perspective.
You talked about, knowing what you have. This is obviously a huge point in medical device security, which comes up. Getting an inventory in that area is very, very difficult, and maintaining it, but it's an important element of providing good security because you can't secure or patch what you don't know you have. Um, that's a tough one, right?
Yeah, yeah. Medical device security is it's super important, right? So we have to keep these devices secure so that they can efficiently and effectively treat our patients. So it's really important that we keep all of those assets tracked. That is part of the standard work of all of our biomedical technicians. So making sure that those things are tracked and into our inventory system. We also make sure that we have those systems up to date in the system, so that if there are recalls put in place, that we're notified. We have some integrations with some partners who send us alerts on recalls, as well as now they're including cybersecurity. So if there is, so like, again, going back to Log4j, Log4j, it was found in these medical devices. You should, and then it gives you guidance. So, hey, here are the compensating controls, here's the mitigating, factors, or here's the patches you need to deploy. And then working through that, because we can't scan those devices for the most part. We try not to use vulnerability scanning software on our medical devices, just due to some of the legacy technology that's in use.
Right. There's a fear that it could be damaged or disrupted by the scanning.
Right, absolutely.
That's tricky.
Yep.
Um, Very, very interesting. Very interesting. You talked about defense in depth, right?
Yeah.
We can't, when I asked a CISO about this recently, and I phrased it this way. I said, "Are you telling me that if the average user, meaning someone with the sort of middle of the road level of permissions, not someone with super exalted rights or that kind of average user clicks on the wrong email, a malicious email, the whole system can go down. He said, yeah. Is is that something that think about that, right? Because I'm like, well, how is this even possible? How is this even? And he talked to me about sort of architecture and things like that, and that he's moving to a different architecture. But currently, the way it is in a lot of places, yes, you can get in at that level, and you could bounce around, and you can wind up and cause a very big system disruption. You talked about defense in depth. We don't want to be in an environment where one click from the average person can bring us down. So what are your thoughts a little bit more about defense in depth?
Yeah, if a single click can take our entire organization down, then I think I may have failed in some areas. But yeah, so from a defense in depth standpoint, yes, people are going to click on links. I mean, we run our own phishing simulations. We send, for awareness. We know folks are going to click on links, so we have to make sure that we have, again, defense in depth. So making sure we understand, we track those links that they click on within their email using various technologies that we have, so that way we can react. So once we know that that link is bad or what that link does, we can take action on not only the user but maybe their end user device. If it completely bypasses those technologies, having advanced tools on your endpoint to look for anomalous activity, having your SIMs, so your security incident and event management tools, having correlation and logging from all the different network systems, applications, any systems that you can get information from, getting that data into one place and having it look for anomalous activity is key. But really, you mentioned this earlier, is they have some, it sounds like they may have had some privilege on the system. The key there is to make sure that you are really limiting that privilege that user has when they're checking their email, because all 20,000 of our users have access to email. We all use it in one way, shape, or form, and the user running that has to have least privilege, and we've really, that's something we push to make sure that when you need privilege, you need to escalate it using different accounts. So really limiting that impact from a click. And there's many other levels of defense in depth that we can go through, but just to keep it at a high level, and to answer the question around no, a click should not take all systems down. Now there's a lot of hoops they go after that they have to jump through after they get access to the system through clicking a link, but yes, defense in depth is key.
You mentioned something I hadn't heard of this before: escalation and de-escalation of a user staying in the same role based on what they're currently doing. Is that something is that what you meant? Because I hadn't heard that before. So I'm in the same role. I haven't changed roles. But based on what I'm doing, my permissions are going up and down. Is that what you said?
Not specifically for that user. So when we talk about escalating your own privileges, so we have there's software that we can allow escalation of certain applications. So if you have an application that says it needs to run as administrator, your account is not going to run that. We're going to give the privilege to that application to run that. That way it's not, we're not going to run the email client as an administrator. So, but the other point of that escalation or elevation would be, I have my own administrator account. I don't log into my system with my administrator account. I just use it to connect to another server or connect to an application to do administration. Other things we are looking at is ways to even limit those accounts to then escalate as needed, or elevate, request to elevate. Okay, you have to approve that. If I need this to do something that I don't normally do, I need to request that and have it approved by whomever, whether it's a system owner, or my manager, supervisor, whomever. So really, making a lot of these administrative tasks and elevations intentional and
Mhm.
not just by default, just because it's what we've always done.
So we know that, based on you saying what everyone's saying, identity and access management is a huge part of good security, but that's doing it is really hard. When you have a big health system, you have thousands of people. The way people practice healthcare, they're all over the place. They're here and there. The permissions need to go up and down as they change roles and change departments and change units. So it sounds great, right? Identity and access management is important. Get it right, have it tight, least privilege all the time. It's hard when the rubber meets the road. Um, and it can be hard, I guess, anytime we get away from pure technology and we're dealing with human beings, that's when things get hard. But your thoughts around the challenges around doing IAM well, and anything that's worked for you.
Yes, identity access management is very hard. That is something that has been new to me when I came to WellSpan 9 years ago at this point. So dealing with an organization this large, so think, I said we have 20,000 employees, but we have an additional non-employee population, so contractors, non-employed physicians, nursing students, folks that are not employed directly by WellSpan. So you have to manage all of those identities as well. So having a really good identity and access management platform to make sure that you have automation in place. HR processes are key as well. So onboarding, offboarding. So making sure that timely terminations occur. So as soon as HR finds out someone is terminated, we need to make sure that that is automatically fed into our system to deactivate those accounts as quickly as possible. Because we know accounts linger on and other, in stories we've heard, hey, so-and-so left 2 years ago, the account's still active, and they're logging in or someone else is logging in with those accounts. So lifecycle management is absolutely huge to stay safe. You mentioned transfers. Transfers is a big challenge within healthcare because we constantly have folks moving to different areas of the hospital. They need different rights in different areas. So creating roles is a large effort. To make sure that a one specific nurse is going to have a different set of permissions than the nurse in another area of the hospital. So making sure that they can do what they need to do, and then make sure that those capabilities and permissions transfer as they need to and as they move about.
Yeah, so you don't want to just keep adding, right? You don't want to just keep adding rights, right? As maybe they did something where they need more rights, and then
Yep.
at some point they no longer need them. That's got to roll off, right?
Correct. Yeah. And temporary, when you have, so and so transfers from A to B, and well, they're going to be doing A's job for the next 2 weeks as well as B's job. So making sure you're tracking all of those and make sure you strip those privileges after the transfer completes. So that those are things that are always going to be a challenge and finding different ways to address those. But it really comes down to making sure that you have certification processes, auditing, and ways to follow up to just have regular check-ins with leadership who are responsible for those staff members to say, hey, do you still need these privileges for these users on a periodic basis?
Yeah, that's huge, right?
Yep.
Because if you
Yeah.
don't know, and I'm picturing you guys, you can get yelled at a lot around IAM, right? You can get yelled at a lot in the sense of, okay, you told me this person needed elevated rights for 2 weeks, so we set it to be revoked after 2 weeks. Well, nobody told me they're going to keep them for another week. All the rights rolled off. They can't do their job. They're screaming at IT. I mean, so there has to be a tremendous. You mentioned working with HR. I would imagine that's a hugely important relationship for
Absolutely.
security. You don't think about it off the top of your head. I mean, if you think about it for more than a minute, you get there, but not initially. Not initially. You don't go. CISOs need to work with HR. That's a tight relationship, but it's huge. So talk to me a little bit about that. I could see hiring and maybe firing, getting that worked out, but these internal changes are more nuanced. And I don't know if HR knows every time. It may be the individual in question or their manager has to know, you got to get in touch with IT. You got to get in touch with IT. Uh, uh, Tell me about this.
Yeah, I mean, HR is just one of the many important relationships any security leader needs to have. So yeah, we work very closely with HR. So not just myself, but the identity access management team must work close with them. Mainly because by policy, if an account's disabled because of a termination, I know we didn't want to go too far on that, but we're not just going to take the word of the employee that says, "Hey, I can't get in." We take the information from HR. We have to work with them to say, okay, can we re-enable so and so's account so that they can finish their work or continue based on what they need to do. But yeah, constantly working with HR to better our processes. Some challenges we have to work through are things like leave of absence. Things like hey, I need to take off 4 weeks for whatever reason I may have. It's approved through HR. How do we make sure that those accounts are secured while I'm on leave, or making sure that I am on leave? And how do we better partner in those areas?
Yeah.
Other
Go ahead.
Okay.
Go ahead.
I was trying to think of a couple of different areas from an HR perspective that we work regularly on. Is just HR deals a lot with employee issues. So we are tightly integrated from if there's audits that need to be performed. We don't do audits unless HR directs us. We're not the internet police. We're not the network police. I'm not watching folks work, contrary to popular belief. But we have to work very closely with them because we support a lot of the work that they do. And they rely on us to provide that information to back up whatever the truth may be in whatever situation they're working through.
Did you say if you had a research arm? Do you
We
do
we do.
research? Yeah.
Yeah, we do, yes.
So I've heard from many that certainly elevates your profile in terms of risk, because that's one of the things that bad actors are looking for. They want research information. Research also, there can be requests for data sharing among people doing research, which is something that probably has to go by you. Can we send this data over here?
Yep.
Um, Research can sometimes involve travel. There was one story told to me about an individual from the health system who did not check with IT and just went on an overseas trip, I think to China. And when that was found out about, their laptop was remotely disabled because they said no, no, no. Lots of stuff. Any thoughts around all that?
Yeah. So yeah, research became a big item, during the pandemic for sure. So working with our different research teams to see, how can we better support them? We protect everyone, but is there additional things that we could do for our research
Hmm.
folks? So see what different technologies, education, can we provide additional education to them um, in different areas? The This isn't necessarily research specific for us, but when we talk about travel, we do restrict access to our systems from outside of the United States. So our firewalls do not permit network connections outside of our business region, right? We don't do business outside of South Central Pennsylvania, but we do allow connections from within the United States. So whenever our folks travel, they have to work with us, or really they won't be able to do work while they travel.
Hmm.
So there are different things that we have to work through. And again, goes back to our partnership with HR. If anyone reaches out and says, "Hey, I can't access the VPN from Canada,"
Hmm.
okay, we understand your concern. We need you to work with HR to make sure that, one, you're approved to work while you're traveling. Is this for business? Is it for personal? And working with them to make sure that travel is approved, and then we find different ways to accommodate that.
Very good. All right. Let me ask you one more question, and then I'll get your final thoughts and let you go. Things go very fast when we're talking. Um, One of the bigger things I've been focused on is business continuity. We want to do all these things to prevent an outage, right? Defense in depth, cyber training. Don't click on this. Um, Lease permissions. So if someone gets in, they can't get very far before hopefully you detect them. It's always disturbing to find out someone's been in your network for 3 months. I don't know how that happens. When the news comes out, they were in the network for 6 months. That's always a little scary, right? Anyway, um, so we do everything we can to prevent, but we have to be prepared to deal with an outage if we get hit with a ransomware attack or something. Certainly, a best practice identified to me has been for the security professional to be working closely with emergency management to sort of get tucked up under that umbrella and educate them in the sense of scenario planning. Here's something that could happen. You're in charge of emergency management. You're probably used to tornadoes and hurricanes and earthquakes, but maybe you don't quite understand how a ransomware incident could unfold. I'm going to tell you about how it might unfold. And now you got to sort of not you got to grab the ball, but together we're going to work. So I want to educate you so you can come up with the overall plan, because as a security professional in IT, I can do certain things, but I cannot continue clinical operations when the systems go down, right? So tell me your thoughts around that whole thing, and specifically, what do you feel is the responsibility of the security professional to make sure the organization is prepared for an outage?
Yeah, this is a huge topic for us, and I think many other healthcare organizations, especially in light of all the attacks that are going on. So everybody has to, answer those questions for their leadership and their boards. They want to know these things. So you talked about emergency management. We work very closely with that team. We're actually part of their assessments. So when they say, they do their risk assessment of, floods, different scenarios, IT and cybersecurity is one of the risks that they rate in all the different locations that they service throughout our system. But you mentioned the business continuity piece of it. How do we make sure we operate the system if or when the systems are down? So we're actually doing tabletops on these now business impact analysis with third parties to help us really identify where those gaps are, and making sure that we address them. If we have plans in place, great, let's test them out. Let's make sure they actually work. We do a great job of keeping our systems up. So a lot of folks have never really had to work off of paper, right? So a lot of the newer clinicians that may be coming in the system haven't experienced any extended downtimes. But hardware problems happen. Hopefully cybersecurity events never happen, but it's inevitable that systems will be down at some point. So we have to make sure that we're prepared to do that. So our role as cybersecurity experts in those situations is making sure that the different business partners understand what is available, what's not, what's safe to do and what's not. So even if a system may look like it's online, we may caution them not to use that just because it may not be available, or it just may not be, or it may be at risk. So each leader in all the different areas from a clinical standpoint and operationally. So it's not just clinical, it would be HR. How is HR going to onboard new staff? If the systems are not online? Supply chain, how are we going to get the supplies we need? How are we going to coordinate deliveries? Things like that. From a clinical standpoint, we have to continue to treat patients. So do you have the charts you need? Do you have paper to be able to do the charting? Do you have everything you need to continue to treat the patients in any kind of extended downtime or incident command?
And again, you're not making sure you have paper. That's emergency management. You're not going to Staples and buying ink and putting them in the closet, right?
No, we can help.
We can help.
I'm capable enough to carry some paper, but no, I'm definitely no clinician for sure.
But those conversations must get interesting when you're describing a potential outage, how it could evolve to emergency management. I would imagine they're eating it up in the sense of you're really educating them, because even if you took it through with me, I'd be like, wow, really? Like, if you were to scenario it out, like, here's what's going to happen, here's what's might happen, here's scenario A. Is that kind of how it works, where you're telling them, and then I would get this information, and then I would call you or something like that? So this is really how these conversations happen?
Oh, yeah,
Yeah.
absolutely. So it's, you know, what's the worst case scenario? Or here's what actually could happen in our environment. So, you know, the health record system's down, phone system's down. You only have some analog phones that may exist in certain places. You know, email is definitely not available, and you know, it's okay. So what do you do in that situation? And then maybe in 2 days we'll tell you something's back up and you may be able to
Right.
use it. Right now we are digitally dark.
Yeah.
So we need to figure out how to do that. So yeah, our emergency management team is very, like I said, we were very involved with them because you know they're the experts in that area, right? They know what happens in major emergencies. This, you know, without any, you know, IT systems, it's definitely going to be an emergency.
Mike, I could keep you all day, but I'm just going to get your final thoughts and let you go. I really could. Any final piece of advice for someone in your position at a comparable sized health system, based on your career, what you've achieved, things that you feel sort of you bring to the table? Any piece of advice for your colleagues?
Yeah. Um, for me, I think the keys to success for any security leader is collaboration and empathy. So you know, most cybersecurity folks that I've worked with have worked in all different areas of IT, so they understand the impacts of security in all the different areas. So you know, asking somebody to patch 100 systems is like, yes, I have been there, I know it, I feel for you. But you know, we have to do those things. So understanding the impacts of what you're doing, and being empathetic, but collaborative, is key to success in a lot of different areas. We can't be secure in a silo. We can't, you know, fix and prevent everything on our own. So we have to work. We have to work together to be successful.
Excellent, excellent interview, Mike. A lot of great stuff in there, like the empathy. So appreciate your time today. Thank you so much.
No, thank you very much, Anthony. I appreciate it.